Imagine a world where nobody has to worry about stressing to find the money that they do not have after leaving the doctor's office. A world where all people have access to the medical attention that they need and deserve. All people, including the ones that are in financial struggles, the ones that are shying away from getting treatment in fear of not being able to pay. This is the idea of universal health care, a system in which the federal government offers medical services to all citizens regardless of their ability to pay. Out of 33 developed countries, 32 of them have adopted universal health care. These countries include Canada, France, Germany, the UK, and others to follow. The demand for universal health care started in 1948, the year the World Health Organization declared health care as a basic human right. So why should the US not espouse this highly impactful system? The US should acquire universal health care because it will allow quality attention, medical attention for all people, and create a healthier workforce. Healthcare is a highly stressful and expensive concern on the minds of many people. Universal healthcare vitalizes hospitals and medical providers to give and treat all of their patients with the same standard of quality, regardless of money. A large, shocking majority of Americans will delay or put off medical treatment due to financial conflict and circumstances each year. Research, according to a Harris Poll survey of more than 20,000 adults, informed that 54% had delayed medical care for themselves within the past year because of cost, while 23% said that they delayed medical care for more than a year for the same reason. This makes a grand total of 77% of the people surveyed that have put off medical attention due to money. For example, Amy Snyder, a 28-year-old graduate student from the University of Arizona, missed a sign-up deadline for health insurance by 1 day. She then proceeded to delay assistance after experiencing shortness of breath and severe leg pains. Amy claims she cannot imagine how she was going to be able to pay the emergency room bill if she went. Therefore, she decided it was going to be okay to wait it out. After finding out she could get a discount on her medical bill, Amy finally chose to go to the ER, where the doctors discovered an extensive blood clot in her leg, with pieces breaking off and traveling to her lungs. Doctors said that she was at risk of dying within hours. At the same time, 10% of Americans with children below the age of 18 have delayed care for themselves or a child because of financial issues. Universal healthcare will equalize the assistance that will be given to patients, making it harder for doctors and hospitals to target and cater to wealthier clients. This is because all patients will now be able to seek treatment and services, changing the ultimate goal of caring for their patients rather than getting the most out of their patients. Countries that have universal healthcare will also impose greater regulations and raise higher taxes to force the population to make healthier choices. They will often charge higher taxes on items such as cigarettes, alcohol, drugs, and anything potentially harmful to one's body. Implementing this health system will not only improve one's health, but also create a better workforce. As countries with universal healthcare will impose higher taxes for a finer, salubrious community, universal healthcare will overall create a healthier workforce, as highlighted previously. 46% of patients in the US went to the ER for medical services because it was the only affordable place before the Affordable Care Act was put into effect. The ER is a place that has to be offered to patients by the Emergency Medical Treatment and Active Labor Act. Therefore, many people would rather go to the ER when they are hit with sudden illnesses rather than taking steps for preventive care, such as yearly exams or a trip to the doctor when symptoms first arise. Every year, more than 900,000 Americans die prematurely due to the 5 leading causes of death for adults in the U.S., which include heart disease, cancer, chronic respiratory diseases, stroke, and unintentional injury. And with this demountable number of deaths that occur every year, 20 to 40% of deaths could be prevented, according to the Centers for Disease Control and Prevention. With universal health care, the encouragement of preventive care would be much greater, and the need for emergency interventions would decrease. This allows people to take more precautions for their health, while also opening up the ER for its actual purpose. Emergencies, of course. Healthcare inequality is currently one of the biggest barriers in medical care, as the U.S. is highly dependent on a person's income. Studies have concluded that the higher a person's income, the healthier that person is, while the lower the income, the more likely they are to be with health complications. However, if the U.S.'s health system targets those who need help and support the most for their wellness maintenance, health inequality will no longer be a dominant reason for the rise in the cost of medical care. Universal health care will then allow health providers to be better able to treat and communicate with their patients, without money being an issue. It removes the superiority of those who can afford medical care and those who cannot. With common health systems today, services are expensive in order to pay doctors more, and the ultimate objective of for-profit businesses is to make more money. So, if the health system is changed to be open to everyone, patient care will focus on helping those who cannot pay rather than those who can. People against universal health care will argue that the money they are paying could be used for services that are not for them, which is a valid argument. Using universal health care forces those who are already healthy and able to pay as to care for those who are poor and sick. In the US, 5% of people consume around 50% of the healthcare costs collected at the end of the year. This means that a small percentage of people who are benefiting from the payment that is collected from health spending funds. Asking those who are more than capable of paying higher taxes is arduous itself. Therefore, it is usually assumed that it would be an overstretch to expect and instruct middle classes to also pay higher taxes for another's health. However, the truth is that most, if not all, people already pay a lot for taxes and even more for their private health insurance. According to an analysis conducted by the Medical Expenditure Panel Survey, if an American earns about $43,000, half of the compensation, including wages and employer payroll and premiums, 37% of it will go to taxes and health care premiums. This impacts families that have children since taxes will reduce with more members. But in the end, it results in bigger percentage of the family income going towards healthcare premiums because there are more people. Although people will need to pay higher taxes, the money will go towards the good of helping people, those who are in poverty, and those not able to seek medical needs. While these ideas have some merit, the financial benefits to universal healthcare companies' administrative costs outweigh their concerns. Now, all people can seek medical attention when needed. Now, all people can feel at ease after leaving the hospital. Now, all children and kids can be treated without their parents' worry about being unable to pay. But this can only be done if the U.S. adopts universal health care. Universal health care will be sure to standardize treatment that is given to every patient, making sure that every person receives standard quality care. It will create a healthier workforce where preventive care is strongly reinforced so that less productivity and time are lost to illness. Ultimately, if we rally together and advocate for this policy in front of our state legislators that focus on improving healthcare, I feel like we can make a stronger effort towards making this a reality, because I feel that collective efforts are stronger than any one single individual effort. Indeed, the U.S. should have universal health care because it will allow quality attention for all people and create a healthier workforce. Thank you.